Good afternoon, everybody. Thank you for joining us here today, and I'm pleased and honored to have Dr. Brent Roussin with me as well. Brent, again, thank you so much for all your efforts. We really appreciate it. Manitobans appreciate it very much. Just yesterday, we announced that our current public health orders will be extended until the new year, and all of Manitoba will remain at the critical level, or red, on the pandemic response system. These restrictions are necessary to protect our most vulnerable communities, ensure our healthcare system's there for all Manitobans when they need it. This, frankly, is a way for us to save the lives of our fellow Manitobans. These restrictions are beginning to work, never as fast as we would like, but Manitobans, need to know that they're working because of Manitobans working at them. And we know that's not easy, but we need that cooperation to continue. Ces restrictions sauveront des vies, elles travaillent, et nous avons besoin de la coopération de tous les Manitobans pour continuer à les faire fonctionner. I've got to be frank today and say I'm quite excited about this announcement, and I know that Brent will give you more detail on this, but we're here to talk about something else that will save lives, and that is the COVID-19 vaccine. Our government's #1 priority is to protect you from COVID-19, and soon, I am pleased to say, we will start delivering life-saving vaccinations to protect those Manitobans most at risk of this deadly virus. We just received word earlier today that Health Canada has approved the Pfizer vaccine, and I want you to know that Manitoba is ready to receive the first doses as early as next week. However, there is only a very limited supply of these new vaccines, and very likely there will only be a very limited supply of these vaccines available before the spring. And so I will say what I continue to say: we cannot let our guard down. The cavalry's not here yet, and we have to make sure that we're defending one another every day. We're going to be focusing our initial immunization efforts on those most at risk. Seniors, those working in the healthcare system with seniors and with others, long-term care facilities, Indigenous peoples, First Nation and Métis. The first doses of the Pfizer vaccine will be enough to vaccinate 900 people. They'll be administered first to frontline healthcare workers in our province's 4 critical care units. Our COVID-19 vaccination task force is working on delivery, priority populations, immunization clinics, logistics, monitoring. We'll have more information to share with you on a regular basis going forward. This is the most challenging public health situation that our province, that our government, that any government, I would say, in our jurisdiction has ever faced. But I want Manitobans to have the confidence of knowing that your government's rising up to this challenge, and it's doing that by relying on people like Dr. Brent Roussin and our healthcare experts. The planning for this massive effort's been underway literally for months, and it's been led by our public health experts. We are working in partnership with public health agencies and immunization committees, as well as provincially based logistics and operational experts. These have been coordinated across government by the Clerk's Deputy Minister Central COVID Committee. I think it is important to understand some of the detail. As best I can communicate it in the next minute or so, I'll give you some detail on who the people are and the agencies that are involved in this planning. First of all, our Vaccine Implementation Task Force, which I referenced a moment ago, it's been working for months, was established by and reports to our Clerk's Central COVID Committee via the Secretary to the Treasury Board. Their purpose, the Vaccine Implementation Task Force, is to adopt an all-of-government approach to develop Manitoba's COVID-19 immunization plan and provide a framework for effective and equitable distribution and administration of the COVID-19 vaccine. Members of that committee include representatives from Manitoba Health, Seniors and Active Living, Central Services, which is the agency that was responsible for catching us up on PPE in the early stages and has continued to do that through the last number of months. Transformation Management Office, Treasury Board Secretariat, Strategic Initiatives, Materials Distribution Agency, Economic Development and Training, Conservation and Climate, and Federal Provincial Relations, Intergovernmental Affairs Services. This task force has been collaborating with national, provincial, and territorial organizations, and we've all been learning as we go from one another. With this unprecedented pandemic, there's been lots of learning going on throughout the entire process. Different tables of learning have happened. There's been a Canadian Immunization Committee, which of course we're a part, Canadian Immunization Registry Coverage Network, a Communicable and Infectious Diseases Steering Committee, First Nations and Inuit Health Branch, in terms of vaccine planning working group, Immunization Coordinators Practice Council, and a National Advisory Committee through First Nations work on immunization, among others. And I reference this because I think it's important to understand the work and the planning that's gone into this, not only here in Manitoba, but across Canada. Yesterday, I was able to pass on my thanks to some of our Indigenous leadership, and I know that they were pleased with the announcement that we were able to make yesterday about the additional 9,600 doses of Moderna vaccine, the one that doesn't require the super cold fridges to protect our First Nations community. It's one that can be transported to communities more readily. And so we were able to get those additional doses, and I thank the federal government and I thank our Indigenous leadership in Manitoba for their ongoing efforts and their work in their communities and elsewhere. We want to have broader access to our northern and remote communities. We know there are higher risks there, and that partnership that we must have in terms of working with our Indigenous leadership and the federal government to ensure that, for example, our precious elders in these communities get that vaccine as soon as possible is really, really important going forward. I'll now turn it over to Brent, and Dr. Roussin, you can get into greater detail on our plans going forward. Thanks for being here.
Well, thanks, Premier. Good afternoon. Manitoba is about to embark on a vaccine campaign that will likely be a unique one in all of our lifetimes. We'll start with what we know. The first 1,950 doses should arrive in Manitoba next week. The province's Vaccine Implementation Task Force has assembled a team from across the government to make our campaign a success. They're making and adjusting plans for delivering this vaccine to every Manitoban who wants it. This is an enormous undertaking when you consider all the details, big and small, that must go into these type of plans. Storage, delivery, other logistical challenges, especially if these COVID vaccines add more to the layer of the complexity. But we're ready. We're recruiting people to lend their skills to a vaccine campaign starting today. We're procuring all the supplies needed to get needles into arms. But behind the immunization clinics are a network of other plans that need to come together to support it. Things like freezers, dry ice, other resources we need to keep the vaccine stable and secure, securing the sites across the province where we plan to hold immunization clinics, all the technology and tools we need to track who's getting the vaccine and when you need to get your second dose. Manitoba's vaccine team completed a successful dry run yesterday at the temporary site in Winnipeg where these initial doses will be delivered. So we're ready. And the first delivery of vaccine is expected very soon. We believe this will be enough to vaccinate about 900 people because we need to have enough vaccine on hand to ensure the second dose is available. Clearly, these doses will only go so far. We know healthcare workers are at a greater risk, and we need to protect them to protect our healthcare system. So as the Premier noted, we'll prioritize healthcare workers most directly involved in the COVID-19 response for these first doses. Then we expect to receive 237,600 doses of the Pfizer and Moderna vaccines between now and the end of March. So again, both of these vaccines require 2 doses. So the number of people we can immunize is effectively less than half of that. In those first few months, we'll need to focus on our priority populations. Too often I'm here telling Manitobans about the loved ones who have been lost to this virus, because we also know older people are at greater risk of becoming seriously ill or dying. With all these factors in mind, these are our priority populations. Healthcare workers most directly involved in COVID-19 response, seniors in long-term care facilities, assisted living facilities, retirement homes, and chronic care hospitals, older adults aged 80 or more, and adults at risk in remote or isolated Indigenous communities. As vaccine supplies improve, we plan to expand to 8 vaccination sites throughout the province so more Manitobans can be immunized. Over 60 freezers have been secured to meet the very stringent physical storage and distribution demands of these vaccines. By January, we'll be able to store more than 1.8 million doses. As I said, the scope of this work is unlike anything most of us will ever experience again. We have taken the time to get it right, and we are ready for this campaign. I'm going to pass it back to the Premier.
Thanks very much, Dr. Roussin, and thank you in advance to the skilled Manitobans that we know are going to step up and join in the fight against COVID-19 and help protect their fellow Manitobans by helping us deliver the vaccine as well. Together we can stop the spread of COVID-19 and keep each other safe, and I encourage Manitobans who have been doing their very, very best through this challenging time to do that very thing. Over the coming days, we'll provide you with more information on the first immunization clinic for healthcare workers and how to book an appointment. And to all Manitobans who want to be vaccinated and are anxious about being able to be vaccinated, I want to share with you that we've been assured by the federal government that they will eventually provide sufficient doses available for you too. But I want to emphasize this will take time. While there's hope now, and we all have that hope that comes with this announcement today and comes with a vaccine, I want to remind all Manitobans that the vaccine is not here yet. So, in the meantime, it's crucial we follow the fundamentals. Limit your close contacts. Don't gather with people outside your household. Excuse me. The first shipment we receive will vaccinate less than 1% of our population. Remember to be diligent. I ask Manitobans to be patient until that day arrives that we can vaccinate all of us who want to get this vaccine. Thank you. I'll ask Dr. Roussin now to go ahead while I'm choking over here to give his regular COVID-19 update. Thanks, Brent.
Okay, thanks. So today we're announcing 18 additional deaths due to COVID-19. This includes a male in his 40s from the Winnipeg Health Region, a female in her 50s from the Winnipeg Health Region, a female in her 50s from the Winnipeg Health Region linked to the outbreak at Health Science Centre, GA3, a female in her 60s from Winnipeg Health Region, a male in his 60s from Southern Health, Santé Sud, a male in his 70s from the Winnipeg Health Region, a female in her 70s from Southern Health, Santé Sud, a female in her 70s from Winnipeg Health Region, a female in her 70s from the Winnipeg Health Region linked to the outbreak at Victoria General Hospital, Unit 4S, a male in his 80s from the Winnipeg Health Region linked to the outbreak at Maples Long-Term Care, a male in his 80s from Winnipeg Health Region linked to the outbreak at Park Manor Care Home, a female in her 80s from Prairie Mountain Health Region linked to the outbreak at Grandview Personal Care Home, a male in his 80s from Southern Health Santé Sud, a female in her 80s from Winnipeg Health Region linked to the outbreak at Misericordia Health Centre's Transitional Unit, a female in her 80s from Winnipeg Health Region linked to the outbreak at St. Norbert Personal Care Home, a female in her 90s from the Winnipeg Health Region linked to the outbreak at Charleswood Care Centre, a female in her 90s from Winnipeg Health Region linked to Park Manor Care Home, a male in his 90s from the Winnipeg Health Region linked to the outbreak at Holy Family Personal Care Home. I'd like to extend my condolences to their families, to their friends, to their caregivers of these lost Manitobans. Our current 5-day COVID-19 test positivity rate is 13.5% provincially, 14.5% in Winnipeg. 280 new cases of the virus have been identified as of 9:30 a.m. The outbreak at Headingley Correctional Centre was declared over an error. The site had been moved further down on the pandemic response system to orange. There are no new cases, and it's no longer classified as a red zone. Restrictions under orange are in place, so we can continue to monitor the outbreak there. We've been able to provide a good news story today with the approval of the vaccine. However, it's not going to have an immediate effect on our public health situation in Manitoba. We're happy to begin this vaccine campaign, but we must ensure we're keeping up with the fundamentals and the public health restrictions. I want to remind everyone to stay home. Our case numbers are still too high. Our hospitalizations and ICU numbers are too high. We need to decrease the number of contacts we have, and the best way to do that is to stay home as much as possible. Go out only for absolutely essential reasons. Only socialize with people from within your household. Connect with family and friends by phone or other virtual means. And we know that this is going to be very difficult through this holiday season, but we have to stay safe. We have to protect the ones we love, and the best way to do that is to stay home. We'll all take action together and stop this spread now. So please stay home, and I'm happy to open up to any questions.
I'll just wind it up. Thanks, Brent. And say the last few weeks have obviously not been easy, and our condolences to the families of those who've lost loved ones and the friends of those who've lost loved ones. Too many lives have been lost through this pandemic, and those who don't think that COVID is real need to understand it's very, very real to the people who have lost a loved one in the last number of months. This next month is not going to be easy either. Don't let your guard down. I'm confident that we can do this work together. Manitobans have done it before. We can do it again, and we can get back to beating COVID-19 as we did in the past. But we must follow the fundamentals. Stay home. Only leave home for essential purposes. Stay home when you're sick. Stay home if any member of your family is ill. Don't socialize with people outside of your household. Wash your hands. Cover your cough. Practice physical distancing. Wear a mask. Be kind. Be supportive to one another. Love one another. It's crucial we do that too. Happy to take your questions.
Thank you, Mr. Premier. A reminder to our reporters on the phone, you will have one preliminary and one follow-up question. Up first this afternoon from CJOB, Clay.
Good afternoon, Dr. Roussin and Premier Pallister. Dr. Roussin, if you could explain to our audience, once Manitoba receives an adequate supply of the vaccine, each person will have to get 2 shots of the drug, 3 months apart from what I understand. Once they've received the shots, will they, for the most part, be immune to COVID-19? And will this be like the flu vaccine? You'll have to get it once a year.
Yeah, thanks. So it's for the Moderna and the Pfizer vaccine, it is 2 shots, 3 weeks apart, 21 days apart, not 3 months apart. And right now in the trials that are being reviewed for its effectiveness, certainly shows that these vaccines are safe and highly effective, 95% effective roughly in people who receive it. We don't fully know the duration of that effectiveness. So your question about will we need it ongoing is yet to be determined. The sense of getting a successful 2-dose with the current level of effectiveness does show that most people who receive that will have a good level of protection, although we don't yet know the duration of that protection.
All right, and any message to some of those, and I did see a recent survey, there are still Manitobans out there that even when it becomes available to them, they are not interested in getting a vaccine shot.
We're going to, be working on our messaging going forward with that. Certainly for these, at least next few months, we expect more demand than we have supply. And so we do have to prioritize. But we really do have the ability in the upcoming year. We're planning to be able to offer that vaccine to any Manitoban who wants it. And we really require a high uptake. It's the best way to protect yourself, but it's also the best way to protect the people around you. So we're really going to be campaigning for Manitobans to receive this vaccine as early as they're eligible. It's our best way to, really bring this pandemic to manageable levels.
From the Winnipeg Sun, Scott.
And say
Good
that.
afternoon, dear both. Scott Billick, Winnipeg Sun. So roughly 114,000 people will be able to get vaccinated by March 31st. How quickly can that happen, I suppose? If you got a shipment of 228,000 doses tomorrow, how quickly can you get 114,000 people or less, depending on how many doses or what you'll have? How quickly can you mass vaccinate people? I guess is what I'm asking.
Yeah, well, there's a lot of variables to that. We're certainly not going to be receiving the vaccine in that manner. We're going to be receiving the vaccine in smaller quantities over that 3-month period. And so, we're planning on being able to get it into arms and, as quickly as feasible. But the rate limiting step will usually, we're expecting to be the supply, at least in the first 3 months. And so for this first round of vaccines, we're anticipating to get that done in, under 5 days. 5 days or under is a early goal for that, but these things can always change on a number of factors.
I'll just add, if I could, that the Vaccine Implementation Task Force work that's been undertaken is incredibly detailed and complex. And I would say that that preparatory work is going to pay big dividends as we move forward to get those vaccines out quickly and safely. And there's already been a what do we call it, a dry run, a dress rehearsal undertaken so that next week we're able to do this safely and effectively. It's not just about speed, it's about doing it well and doing it accurately to make sure the results are what we want. The Vaccine Implementation Task Force is comprised of 8 different working groups looking at things like logistics, operations in terms of clinic establishment, storage, IT, even things down to booking appointments. And each of those 8 working groups has between 5 and 8 different subgroups that's working on special projects. So there's an incredible amount of work that's gone on and is going to go on going forward to make sure that we are ready, and more of that work will be shared with you in the coming days and on an ongoing basis as we move forward as well with Manitobans through the media.
Thanks for that. And my follow-up is, I guess because they're coming so incrementally in the first 3 months, you wouldn't be able to, let's say you couldn't vaccinate 228,000 people with like start their vaccination. I don't know if you want to call it a program for each person, but start that with everybody and then just wait for the next shipment. Because I guess I'm guessing the shipments at this point we just don't know when more will be coming, so you can't kind of hinge on the fact that more will come, and you could do 228,000 people to start. And then 3 weeks later, you'd have that many doses. Would that be correct?
Yeah. So early on, especially early on, where we're not completely sure of the supply chain, right? It's a relatively new vaccine, has stringent storage requirements. We're going to have that second dose on hand for everyone who's received the first dose to ensure we're going to be able to offer that second dose. And then so remember that those 200,000 doses are not coming at once. They're going to be small amounts throughout that 3-month period. So there'll be people, at the same time receiving their first dose, while others might be receiving their second dose. So it will be a parallel program.
From CBC Radio Canada, Mohammed.
Hello, Dr. Roussin. Hello, Mr. Premier. I was wondering, I understand that Premier Pallister, you were meeting with Prime Minister Trudeau tomorrow to talk about vaccine distribution, among other topics. And I was wondering, what are you planning to ask him tomorrow?
There are actually two major topics tomorrow on the agenda. The first is the vaccine and various aspects around it. The second is the renewal of the federal government's partnership in funding health care across the country, an issue that Manitoba has been pushing since I became Premier and will continue to push after tomorrow if need be. But we're excited to see the federal government resume its rightful responsibilities in terms of supporting health care across the country. On the vaccine issue, you asked what specifically. I'll continue to raise the issue of Indigenous people's need, a greater need, in remote, especially in remote northern communities with higher positivity rates generally and very vulnerable, close living populations in many cases, as I have for 3 weeks in each of our calls over the last 3 weeks. I'll continue to raise that because although we got some good news yesterday on the addition of almost an additional 10,000, close to 10,000 vaccines in the first quarter, our population, of course, in Manitoba is much, much higher than that of Indigenous folks who live in these northern and rural settings. And so it is very important that we can coordinate that well and that those vaccines can be here as soon as possible. I raised this with Grand Chief Arlen Dumas yesterday, and I know that we're in agreement on this being a very, very high priority, not just here in Manitoba, but in other provinces as well.
Thank you. And my follow-up is for Dr. Roussin, I guess. I just want a precision. When you have the first shots of the vaccine, do you need to self-isolate and to wait for your second shot, or it's not necessary?
Okay, yeah, great question. Thanks for that. So these vaccines are inactivated vaccines, or they're mRNA vaccines, the early ones. So you cannot get COVID from these vaccines. There's zero risk for that. So absolutely not. No one needs to self-isolate just because they've got the vaccine. So great. Thanks for that question.
From CBC Manitoba, Bart.
Hey, Dr. Roussin. Okay, so adults over 80 and healthcare workers are in that plan for the first 3 months. You mentioned a clinic or an appointment. Will this be, can you just describe the scenario? Will people be able to call ahead of time, or can people just show up and show their ID that they're a member of these groups? What is the intention here for this? How this actually rolls out when we start getting beyond those first 900 healthcare workers?
Yeah, so I think we'll probably have more details on those type of things, but absolutely we want to ensure that the priority groups are the ones that are receiving this vaccine. So there will be methods to ensure that people who are booking appointments will fit those priority groups. So we know that there will be some scarcity of the vaccine, at least early on. Again, we expect to have enough vaccine in the upcoming year to vaccinate any Manitoban who wants it. But early on, we need to ensure those scarce vaccine doses are getting to the right people.
And more along those lines, because of the scarcity, how will you determine which remote First Nations, which personal care homes will get it first? Is it going to be a matter of where the outbreaks are, where the places that are actually least affected so far? How will you determine which specific locations within those initial subgroups?
Yeah, and so this is part of the challenge with it. We set out priority groups, which is, challenging in and of itself. But then, like we said earlier, we're not going to just receive this vaccine in one lump sum. We're going to have to make choices, and we're going to have to sequence this. And so we'll take a number of things into account, such as, where the most transmission is taking place, looking at those type of factors. So we will have to make some of those choices during the sequencing, but we do intend to get to those priority groups during that first quarter of next year.
From the Canadian Press, Steve.
Dr. Roussin, I'm hoping you might be able to explain what people might be able to do. Those 2 doses of the vaccine, as I understand it, are 3 months apart. After getting the first or even the second dose, are they subjected to fewer restrictions than the general population? Can they go visit people who have also been vaccinated?
So we're just, we're really at the beginning of this vaccine campaign. It's just got approved today. So the 2 doses are 3 weeks apart, 21 days apart. And so as of right now, we have such limited doses out there that we're not going to be changing any public health messaging for people who may have received these early quantities versus people who haven't. We need all Manitobans to stay on guard during this period. We're at a real critical period here where we have some good news. And it's no doubt is good news that we have a vaccine, but we can't let our guards down because of it. We have to be patient and get some good population level coverage, and then we can start discussing things like that.
Steve, just to build on what Dr. Roussin just said, I think it's an excellent question, and it's one that the public needs to consider. There's actually the very real danger that with us acting in anticipation of a vaccine that is not here yet, we may change the behaviors that caused us to get COVID numbers to start retreating. And we do not want to do that. And so it's a sort of dichotomous situation. We can't let our guard down. And going forward, it's going to be especially a challenge as the vaccine comes in limited numbers with limited availability. It's going to be really important that we all remember that there are a lot of other people that don't yet have the protections some may have going forward, and that they will count on us to protect them as well while they're waiting for the vaccine, even though some of us may have had it.
And my follow-up question, Premier, is later in 2021, when the vaccine gets more widely distributed, even into 2022, as we get more and more of the population vaccinated, are you looking at something of a vaccine passport, as has been discussed in Ontario, where once the vaccine again is generally available, people might have to show proof of vaccination to go to a mass event like a theater or a concert, that sort of thing, that could both protect public health and encourage use of the vaccine?
We've got almost 60 different working groups and subgroups working on issues right now, Steve, and I must be frank with you and admit that I'm not sure that's an issue that's yet being examined by one of them, but it's now been added to the list. It's a perfectly legitimate question. We are already in discussion around how do we encourage people to get this vaccine. There was a previous question on that. And I'll throw in my plug, which I should have done earlier, I guess, and say, sure, we know that we don't know of anywhere in the world where the vaccine's been made mandatory, do we, Brent? Nobody's said that you have to take it. But understand the decision-making process around a lot of other ailments may be somewhat different than this one. Understand that you may have the right to not take a vaccine for some ailment, but the COVID killed 18 people today. It's killed over 1,500,000 people globally. And it communicates, and it transmits, and it's very, very sneaky about it. And you might not even know you have it, and you're giving it to someone else. And so once that vaccine is administered, that's not going to be you that's giving it to someone else. So Brent referenced it before. Think of others too, not just yourself. It's one thing to say, I'm going to take a gamble. I'm not going to get COVID. I'm young, and it's fine for me. It's quite another to give it to your grandmother. Quite another thing. And so we are going to be looking at ways. and we are studying this now, how to encourage people to help us develop that so-called herd immunity here in Manitoba so that we can protect one another very, very well from this very, very dangerous adversary that is fatal.
From CTV Winnipeg, Jeff.
Oh, hello, gentlemen. Jeff, CTV Winnipeg. Could I just get a clarification? And I'll use the first 900, I guess, as the example. A lot of this obviously will be clinic and an appointment. I get that. Can you explain to me, though, even just I'll use the first 900, I guess, as an example. Will those people be contacted, be like, hey, you're eligible, make an appointment, or as they try to make an appointment, it will be determined if they are eligible, and it'll be a first come, first served basis? I hope that makes sense.
Well, because this is such a limited distribution, and we have a very focused eligibility criteria, we're working on ways to be able to notify individuals who are eligible and how they can book an appointment.
And Jeff, there's subcommittees working right now on the logistics around when a greater number of vaccines will be available and the notification and appointment processes that will be used at that point in future. And as I committed to earlier, we'll be sharing the updated information with you as we move forward in advance of that so that we can make sure Manitobans are in the loop on the whole vaccine strategy.
Thank you for that. My second question is a non-vaccine question. We're speaking to a guy today, Dr. Roussin, who got a ticket for not wearing a mask in a parking lot. Can you clarify the rules for us around mask use in public? Like, I guess, how would an individual get a ticket for not wearing a mask in a parking lot?
So I can't speak to the details of that situation. I'm not aware of that situation. Our mandatory mask requirements in our orders are indoor public places.
From City News, Mike.
Good afternoon, Mr. Premier and Dr. Roussin. My first question is similar to Scott's. Is there any point within the next year that you think, and this might be a hard question to ask, that we will be able to get, say, 900 vaccines 1 week and within 3 weeks have another 900 so that we can do a full 900 vaccinations instead of 450? Or should we always, for the foreseeable future, be dividing the number by 2 when we get vaccines?
Yeah, I mean, that's going to depend. This is very early on, right? Like, we haven't received a single vaccine yet. It's just been approved hours ago. So we're going to have to see what that is. So it's very early on. We're going to, right now, we've decided to ensure we have enough on hand for that second dose. If, we see the supply chain is very effective, then we can revisit that.
Yeah, understandable. My follow-up question, as per the Premier's comments about how communicable the virus is, is there any jobs that will be subject to requiring the vaccine or a punishment if they don't? Say if a nurse doesn't want to get it and they still want to continue working. Has there been any thought about that?
We have not contemplated mandatory vaccination at this point.
From CHVN, Taylor.
Hi, good afternoon. I know in Ontario they're talking about possibility if someone doesn't take the vaccine, they may not be able to attend some public events. Is this something that Manitoba is thinking about, or will there even be different public health orders for people who do and do not get the vaccine?
So this is, an interesting concept. It's very early. So again, we don't have a single Manitoban vaccinated yet. So we'll, start looking at those type of things. We do want to find ways to encourage vaccine uptake. Like I said, it doesn't only protect that individual; it protects all of us. So we do want the vast majority of Manitobans to get vaccinated. We don't know things like the duration of immunity from the vaccine. So there's a lot of things we're still learning, and we're really early on in this campaign, but those type of things will be visited.
And Premier Pallister and Dr. Roussin, both of you talked about this being good news and that it's bringing hope, but for the both of you, what does this vaccine mean to you?
Well, I haven't slept very well for the last 8 months. How are you doing?
Much the same.
Yeah. We want hope too. We want to see everybody that can as soon as possible get vaccinated, because we know at the front line, me elected, you not, Brent, but you're doing a great job in spite of the fact that you haven't run for office. You could now. But we live this every single day, as does our entire cabinet team, as do our frontline workers, as do our nurses, as do our doctors. We see the consequences of this thing every single day. And so it is our hope that as soon as possible that we can get through this thing together and get that vaccine out there. Absolutely.
From the Winnipeg Free Press, Larry.
Dr. Roussin, or the Premier, the first 900 people who are going to be vaccinated, they are going to be healthcare workers. Are any of them going to be healthcare workers outside of the perimeter highway receiving this vaccine?
So this is the criteria that we're using right now. It's very limited. There isn't a specification on on location. It's more based on where you're working. So right now we're talking about the critical care workforce, and so the vast majority of those are within the perimeter. And so we'll have more specifics on this as we further delineate that group.
It looks like between in January and the end of March, there'll be maybe another a little over 100,000 people will be vaccinated. And there's many people who reside in personal care homes, and there's many who look after them, and there's thousands in the healthcare system. So should we expect that nobody outside of a care home or nobody outside of the frontline medical staff will be getting a vaccine by April?
No, I don't think so, Larry. I think we've already got a designated and pretty significant commitment on Moderna vaccines, which can be transported to northern communities, Indigenous communities. The tough part with the Pfizer is it's not transportable, right? Because it's got to be held in a big fridge with minus 80 degree Fahrenheit, and it doesn't transport well. But with the Moderna, it can be transported. So with northern communities, as we talked about yesterday a little bit, there's the possibility to get more of that vaccine up to the north. But beyond that, in terms of additional vaccines, of course, this is where the challenge comes in terms of the prioritization. This is why for quite a while now, I've been of the mind, and I've expressed it, that we need to have more coordination among all of Canada, so that we're able to say we have a more consistent approach being taken all over the country, not different on one side of the street in Lloydminster from the other side of the street. That being said, we're accepting the responsibility. We've outlined a little bit today our broad priorities, and we'll get into more detail. But I'd ask Manitobans' patience and understanding that these vaccines aren't all going to come at the same time. We can't give everybody the vaccine at the same time. We're going to have to make some prioritization decisions. And I know Manitobans understand that, but I know also how emotional this is for many families who really want this vaccine for their mom, their dad, their grandma, their grandpa right now. I get that, totally do. We're going to do our very, very best with the limited numbers we have, and we're going to keep our guard up and make sure we protect the rest of us as well while we're going through this process together.
From Global News, Joe.
Hi there. Quick question on vaccine compliance. How much of the Manitoba population do you think should be vaccinated for it to be effective?
Yeah, so it's a good question. So when we calculate the herd immunity, the level of uptake that we need in herd immunity, we calculate that by 1 minus the inverse of R naught. and the R naught for this coronavirus is thought to be about 2.5. So it's roughly around 60%. So we need well over 60% of Manitobans to be vaccinated to start seeing that herd immunity effect.
Thank you. And for people in high priority groups, if somebody in that high priority group already had the virus, are they still at the top of the list for a vaccine?
Yeah, you know, this is a great question, and we're still working on that. We're still, discussing at the national level on people who have recovered from the vaccine or recovered from the illness, whether they still should receive a vaccine and when. So there'll be more to follow on that.
From the Brandon Sun, Michelle.
Good afternoon. People are understandably saddened and or angered by the current state of affairs, with some already announcing they will gather over the holidays, regardless of public health orders. Then we have readers requesting specific clarifications. Here are two. Can a solo living mother with a daughter and son-in-law living in the same town spend Christmas together at mom's, or is it just one person and not the couple? Similarly, can a person, say a grandparent, spend Christmas with a single household of multiple people? Or again, is it only one-to-one?
Yeah, and so these are great questions. And, you recall when we first started moving into the red restrictions, we had restrictions in place that it didn't require us to get down and interpret every, single eventuality like this. But we had to go to black and white orders. And so when you have black and white orders, then there has to be a line drawn. So right now the orders is if a person who lives alone, they can designate one person to come spend time with them, not two, but one. But it's also the reciprocal of that they can then visit that person in their household as well. So that's the strict interpretation of those orders. What we are advising is to socialize only with people in your household. There are some exemptions, like the one you just noted there. People who live alone, we want to ensure that they do have the ability of FaceTime with other people. But all of this comes with some risk, right? The more contacts you have, the more risk there is. So that's the interpretation of the orders. Our messaging is to limit your contacts as much as you reasonably can to people of your household.
Thank you. My second question, can we be informed of test positivity rates for all of Manitoba's separate health regions rather than just selected areas?
Yeah, the issue with this is that when we get into lower denominators, then a rate like that is it's variable and very tough to rely on. So we talk about the province as a whole, and of course Winnipeg has a huge denominator. When we talk about health regions, for the most part, we don't regularly report on that, just because there's a lot of variability with it. So we have at some times, when we saw, say, in the Steinbach area, when we had very high test positivity, we'll disclose that. But we don't do it regularly because it's a difficult one to provide any accuracy to.
Thanks.
From the Globe and Mail, Shannon.
Good afternoon. My first question is for the Premier, and it's not in relation to vaccines, but a Deloitte study commissioned by the Canadian Medical Association and released back in October says Manitoba will need to invest an additional $68 million in healthcare funding to clear the surgical backlog caused by the pandemic. So what I want to know is how much of a priority is clearing the backlog for your government, and how much new funding are you prepared to invest to address that issue?
Well, it's obviously a growing priority as each day of these COVID restrictions and the COVID case numbers cause further backlogs to occur. This is a problem right across the entire country, Shannon, and it's a problem that won't go away very soon. It will take a long time to clear this backlog. So part of our discussion tomorrow with the Prime Minister is centered on the need for a funding partnership that can help, at least in part, not hopefully just in the short term, but in the longer term, to address the reality of growing numbers of patients waiting for surgery, treatment, and tests in all parts of the country. The wait times are up in virtually every province for every aspect of medical care. And so this is why we're, as Premiers, united in wanting the federal government to step up and resume its rightful role as a real partner in funding healthcare, not just for COVID. And the COVID-related consequences have been, an absolute illustrator of the pre-existing problem of longer waits for procedures such as the ones you're referring to.
Sure, thank you. And following up on that, if the federal government doesn't come through with the demands of the provinces, how much will your government, how prepared are you to go it alone and make those investments to shorten this backlog without the assistance of the federal government?
It's a hypothetical question I hope doesn't have to be addressed, but it's been being addressed by provinces for some time now as the percentage of federal support has dwindled over the last number of years. The provincial share of health budgets in almost every jurisdiction has gone up significantly on the pie chart, so that we are taking money out of other things, education for our kids, or care for people who are living in poverty, or road investments, because we have to do the investments in healthcare. There is no option there. For Manitoba, we are first in the country in investing per capita in health, education, and family services, the #1 province, but asking us to continue, and other provinces to continue, to keep escalating our investments on healthcare year after year after year with an aging population and growing demands is just not realistic. And every single study has said that. In fact, the present Liberal government said it themselves when they were in opposition, but they changed their mind when they got into government. Now they need to change their mind back, and they need to get behind the provinces and partner with us to make healthcare a real serious priority, because Canadians shouldn't be waiting longer and longer times to get procedures and tests and so on. This is not a sustainable situation. We need to get back to being sustainably managed here with a partnership that works for Canadians.
Thank you.
From APTN, Brittany.
Good afternoon, Brittany Hobson, APTN National News. I'm just wondering, in planning, where, or if you've thought about urban Indigenous folks in either Winnipeg, Brandon, or Thompson, and where they will fall in vaccine distribution. We have a particularly high number, especially in Winnipeg, dealing with some of the health concerns that people on First Nations are dealing with as well, and the numbers have been particularly high for off-reserve folks who have gotten COVID, and we've seen a number of deaths. So I'm just wondering if they will be, how they will be included in the rollout. Will they be lumped in with the general population? Have you guys talked about that?
Yeah, big time, Brittany. Thank you very much for raising this. I've been raising this repeatedly. Just to give an example, this is why we need a better coordination between the federal plans and provincial plans. Manitoba, of course, you know, outside of the territories, of course, has the highest percentage of Indigenous population in the country. And about half are folks that don't live on reserve anymore, right? They've moved to the communities that you named, and many others in our province. This is where coordination is so critical. I referenced this before on the call with the Prime Minister, referenced it last week. Some people misunderstood when I said, I made the point that we have to coordinate this, or the non-northern folks are going to be at the back of the line. When I said that, I was talking about all of Manitobans, including Indigenous Manitobans. Winnipeg has a significant population, for example, of Indigenous folks who need to know when they're going to be able to get this vaccine. And we need to coordinate that to protect all of us. And what we don't need is a plan that's disjointed. So again, several premiers are asking the feds for the same thing I am, some coordination and information on how we're delivering. Because imagine if we delivered the vaccine to OCN or Broken Head before we delivered it in Winnipeg, the folks who come from those communities would be tempted then to go to those communities. And in doing that, we know from Dr. Roussin's comments that when we move, COVID moves with us. We could be actually creating an additional number of cases with that approach. We have to coordinate to protect not only, obviously, not only our First Nations and Métis population. We have to coordinate well here to protect everyone. We're all in this together.
Thank you. And I guess to follow up, looking at the Métis population too, I mean, President Chartrand has come out and said that he's not been included in any of the planning, and he has concerns about, his Métis nation. So I'm just wondering, has anything been talked about in respect to the Métis folks?
I've specifically raised Métis concerns on the calls with the PM himself. So President Chartrand need not be concerned that his Métis nation is not a priority for this government. It is, and it continues to be. The fact is, though, that we're all in this together, and we need a coordinated strategy. And so we're announcing today some good news, and certainly I've given you a little insight into the planning processes that will lead us to be confident that we have the best plan we possibly can have for vaccination. In the interim, we just need to continue to focus on protecting one another by listening to the fundamentals that Dr. Roussin and others are preaching, and make sure that we realize that that's our best defense as we move into the era of having a vaccination available later on.
Our final reporter this afternoon from CBC National News, Cameron.
Hi, guys. Good afternoon. Just to clarify, I think you said there's 4 critical care units where vaccines will be going. We have 7 locations in the province where there are COVID patients in ICUs. Would workers in all 7 of those locations be eligible for the vaccine in the first round here?
Well, I think the details of who's going to be specifically eligible are still being ironed out. We're looking at the critical care workers right now. And remember, this is relatively small amounts of vaccine. This is intended to be that initial working out of our campaign, and so we just we have to have a very targeted eligibility criteria. So the specifics of that are yet to be determined, and all those people who are eligible will be contacted.
I raised this issue with Grand Chief Arlen Dumas yesterday. We had another productive discussion, and he's very supportive. He understands, although we both also want to see our Indigenous communities in receipt of a vaccine as soon as possible. He understands that Indigenous folks depend on ICU care, as we all do, and that the ICU workers are in a critical situation. So it was certainly, I think there is agreement that these frontline people that are at risk are our top priority right now. But the discussion in the months ahead is going to be on who gets it first. We all know this, and there's no secret that we know, most of us know the severity of COVID, and understand that this is an urgent and important thing for us to get this vaccine out as broadly as possible.
And if I could follow up with the situation in Shamattawa, Mr. Premier, obviously the situation up there is getting worse. People are coming out of the community. They're drawing on provincial resources. Our understanding is that may have a bearing on what the military may or may not be able to do if it's determined that the military comes in. At this point, has the military been in contact with the province about what it may do in Shamattawa, and is the province supportive of the military coming in?
I had a briefing on that yesterday, Cameron. I can only tell you that the situation is evolving, that we're working closely with the feds and with the military in addition to that, in terms of discussing where the optimum uses can be and in the time frames, if necessary, to have military availability. This was something we appreciated in terms of Opaskwayak First Nation, as you know. That partnership worked well there, I think, and I congratulate Chief Sinclair as well for his leadership in that community. First Nations leaders have done an exemplary job in respect of trying to head off COVID and now trying to deal with the reality of it, just as many premiers are doing. and I congratulate them on that. So we'll continue to work close partnership with them. I understand that's our last questioner, and I thank everyone on the call. I want to finish by saying I hear another comment in the media this morning from one of our Reeves suggesting, and I'm quoting him now, this is not a pandemic. And I have to say to those of you who don't believe such is the case, we had 18 deaths today. There have been 1.5 plus million deaths worldwide. And so to the Reeve of La Broquerie, I have to say, sir, we live in the Red River Valley. It is flat between you and I, but the world is not flat. You need to understand there is a real epidemic out there. It's a pandemic, and people in your area are getting COVID too. So please, sir, it's not a myth. It's a reality. Let's work together and make sure that we lessen the impacts on Manitoba families wherever they live as much as we possibly can going forward.